conversation. And here we are, April 2021, when we've seen so many of you go through this programme, and great to hear the leadership impact it will have on you, and importantly, the children and the families that you look after. And I don't know whether the group of you know, is Neil in the audience, by the way?
No, I can't see Neil.
Oh, okay, well, I won't mention it then. Fine.
Sorry, Neil will be joining us later. I think he has some presentation to do this morning.
Okay, well, I'll let him tell you, but we are going to have the most amazing year this year, and it's unfortunate that we cannot. So we are having a Westminster Abbey event on the 12th of May to celebrate Florence's anniversary of her birth. Normally we'd have 2,500 people, and normally we would have you in that audience, in that congregation. This year we can't. We're going ahead, but with only 60 people. So please, we will be streaming it. We'll send you the link so you can see what's going on. But I'm really sorry for that. But I'm hoping the rest of the day is fantastic. You'll enjoy your presentations. I can't wait to hear, and I will listen in the background. I'll turn my video off and my noise off, but I'll listen into the background because I cannot help myself being curious. So really, really interested to know some of the projects that you've done. So thank you once again for your commitment, your passion, your enthusiasm to be even better nurses than you currently are, and let this be the end of the beginning. Is that right? Churchill's, but I've wrongly paraphrased him, but never mind. You know what I mean? Today is the start of a new beginning. So you're very welcome. Congratulations, and I look forward to hearing what you've got about to say.
Thank you so much, Greta. That's absolutely wonderful. Got us off to the best start. And now I'm going to hand us over to Liz, who is, as I said before, the Deputy Chief Nurse at Health Education England, and had the insight really to see the potential that this programme could offer, and was able to provide sponsorship for it. So huge thank you to you, Liz, and over to you.
Thank you, Gemma, and good morning, everybody. And huge thank you for allowing me to be part of this very special celebration. You really are amazing children's nurses and do an incredible job, not only supporting children and young people, but also you care for their families and carers as well. And I'm sure your work life has been really challenging over the last year, and you have my absolute admiration for the way you've juggled work and family with not only the programme, but with a quality improvement project, and done it all so successfully as well. And I'm really looking forward to hearing from some of you about that work and celebrating what you've achieved over the last year. And HEE is really delighted to be able to sponsor this programme. But actually what I want you to remember is, we provided the money, you brought the talent. That was already there, and the programme was able to build and develop this. So be proud of what you've achieved. And I really hope that this is just the start of some amazing career opportunities for you, because now we have a whole cohort of Roald Dahl's amazing children's nurse leaders as well, which is just fabulous. And I'm really looking forward to hearing from some of you today. So thank you for inviting me.
Thank you so much, Liz. That's really wonderful. And finally, a welcome message from Sophie.
Thank you, Gemma. Well, I just really wanted to say that it is a real honour to be here at this celebration event. And on behalf of Louise Agrew, our Chief Executive, the team and trustees of Roald Dahl's Marvellous Children's Charity, I'd like to express our grateful thanks to Greta, Gemma and yourself and all the team at Florence Nightingale Foundation for supporting 20 of our Roald Dahl specialist nurses in their leadership development through this highly esteemed programme. I would also like to thank you, Liz, for providing the funding to enable the Roald Dahl Nurses Programme to take place. We are really grateful for the investment that you have made in our marvellous nurses. Roald Dahl's Marvellous Children's Charity provides specialist nurses and support to seriously ill children and their families. We place huge value in supporting our nurses to be the best that they can be for their own personal development and to keep improving for the benefit of the children and the young people in their care, and of course their families too. Hence, training and development is a key area of our work, alongside establishing new Roald Dahl epilepsy or other specialist nurse posts, building a strong nursing community for peer support and sharing best practice, and a focus around nurse-led innovation and family support. And finally, I'd like to say an enormous big thank you to our Roald Dahl specialist nurses for your dedication, hard work and commitment in everything that you do. We are so proud of you. In spite of the challenges the pandemic has brought this last year, you undertook this training opportunity, committing time, energy and huge effort to deliver your quality improvement projects. There are some really, really interesting areas of service improvement. And I know that we're all really looking forward to listening to some of your presentations and reflections on your own leadership development journey. Thank you so much.
Thank you, Sophie. That's wonderful. So we've gotten off to a great start with those real key messages of celebration and acknowledgement of this endeavour. But what we're going to do now is have an opportunity to hear from some of you who were selected to present today. So those of you that submitted your posters as the outcome of your leadership programme, you were judged by Claire Henry, our expert in quality improvement, and also one of the F&F team members, Joe Matheson. And we identified from the group that was submitted 5 that we wanted to share with you guys, with each other, and also our guest speakers today. And these particular presentations shone out because they really demonstrated how nurse-led innovation makes a key difference, and how we can use QI methodology to really demonstrate that impact, so that we can go to our boards and our decision-making forums and really be able to champion for the changes that we know are needed for children and young people. So well done to all of you that were selected today, but also all of you that submitted your posters. It wasn't an easy decision, and every single one of you could be up here being selected. So well done to everybody. So our first presenter is Tina. Tina Boswell is going to talk to us about increasing patient safety referrals into the Roald Dahl Rare Disease Specialist Nurse Service. I'm going to have to ask Tina, because of our tight schedule, just to keep really close eye on time. We've got 10 minutes each for our presentations, and then we'll be able to have a couple of questions from our audience. So I'll prep our guest speakers, Liz, Sophie, Greta, and other Liz Frad and Liz Fenton, so they're ready to respond with some questions following your presentation, Tina.
Well, good morning, everyone. For those of you who don't know me, I'm Tina Boswell. I'm one of 4 rare disease Roald Dahl nurse specialists in rare diseases at the Birmingham Children's Hospital. At BWC, we're incredibly proud to be the home of the UK's first rare disease centre for children. In line with the government's UK rare disease framework, and as part of our trust pledge to develop and promote strategies for rare diseases, the Roald Dahl Rare Disease Nursing Service was established. Our service helps families affected by rare and undiagnosed conditions. So why do these families need our support? So rare diseases are not uncommon as a collective group. 75% of rare diseases affect children, and very sadly, 30% of patients with a rare disease will die before their 5th birthday. Rare diseases usually affect multiple body systems. Patients face multiple hospital appointments and admissions and complex condition management. They require the expertise of multiple specialities, and these can be spread over numerous hospitals. They require coordination with allied health professionals and social services. And we know that caring for a child with a rare disease presents an immense financial burden and very often one or both of the parents have to give up employment to care for the child full time. And obviously this presents a huge emotional impact for not only the parents, but the wider family. The next slide, please. As a nursing service, how do we support our families? So we help families navigate the health and social care system. We provide a single point of contact. We signpost to the charities and supportive agencies. We provide coordination of care, and we really try to bridge that gap between hospital and community services. And of course, we provide a huge amount of emotional support. What was the challenge for our service? We saw a 50% reduction in the amount of patient referrals in 2020 compared to 2019. Next slide. And what was the reason for this? And I'm sure you've all guessed. It was that global pandemic, COVID-19. And because of this, we saw cancelled appointments, reduced outpatient clinics, redeployment of staff, reduced hospital admissions, reduced face-to-face appointments, suspension of community and home visits. And in amongst all of this, we also had our rare disease consultant go on an extended sick leave. So what was our aim? Basically to double our current number of referrals whilst maintaining our current existing acceptance rate. So what did we measure? We simply produced a simple run chart that showed the period of March to December 2019. We had an average monthly referral rate of 7.8 with an acceptance rate of 60%. In that same period in 2020, we saw an average referral rate of 3.9 and an acceptance rate of 64%. So using the data, we were able to work out then an average of 7.8 referrals with an acceptance rate of 4.7 per month would be required to return us to 2019's referral rates. But we also looked at who was referring into our service, and that really helped us understand which groups and services we needed to target to increase our referrals further. So how do we go about achieving our aim? So using the plan, do, study, act cycle, we developed a 5-point plan. So number one, we continue to collect that data and analyse it regularly. Number two was to work with trust teams to develop a clear pathway for referring into our service. 3, we worked with service managers to ensure all monthly genetic clinics are held in the rare disease centre and supported by a rare disease nurse. Number 4 was to work with our high referring groups to maintain their current number of referrals, but also to look at really improving the quality of those referrals, which would increase our acceptance rate. And number 5 was to work directly with the low referring groups to increase their referrals into the service. What have we achieved so far? So working with our service managers, we've now secured all genetic clinics and they're all held in the Rare Disease Centre and they are fully supported by our rare disease nurses. Rare disease nurses also now support specialist clinics, including tuberous sclerosis and George. And we're also in discussions with a number of consultants to support other specialist clinics. We promoted our rare disease nursing service on the Trust Internet during Rare Disease Day. And we've started that direct work with high and low referring groups. And we also are hopefully going to be working with our marvellous charity to produce a promotional video that we can send out to these professionals and services. And we've also set up our 3 monthly referrals meeting to review our progress regularly. So what did I learn? Basically, keep it simple, don't overthink it, and really don't underestimate the impacts that small changes can have. Planning really is the essence, and finding a measure that's easy to carry out. And playing to your team's strengths. Shorter, frequent team discussions really help focus and keep the momentum going. And everyone can help you learn something. Networking brings an outside perspective and fresh insight. But what is the real impact? So going back to those small changes and making a big impact, I wanted to explain what really those referral numbers actually mean. And of course, they mean families and children in need of our support. I was going to share 3 examples, but just because of time, I'll just share one. I just wanted to share a referral that we had as a direct impact of the QI project. And that was a referral from a community physio team after we'd made just a quick phone call to explain what our service was and share with them our referral form. And they referred in a 5-month-old baby who had no abnormalities picked up antenatally, but was born with dysmorphic features. He was bilaterally deaf and had a small heart defect. The family were discharged with just a health visitor for support. At 4 months old, the parents received a devastating diagnosis of a rare disease through a letter through the post and were not given any support. The family were obviously devastated and just felt lost. Luckily, we'd spoken to that physio team and they referred this patient to our service, and we immediately set up a Zoom call. And I can't sort of describe how desperate this family were and how much in need of support they were. So how have we helped them so far? So we've supported the family during clinics. Because of COVID, Mum was attending these appointments on her own and was obviously incredibly emotional and not really taking in much of the information that was given. So we've supported her through her clinics. We've supported coordination of those appointments. She was getting up to 4 appointments in the same week. We've made referrals for the parents to our Health in Minds team. We've coordinated the care with the community teams, and we've provided that much needed emotional support and that constant, and we will be there to support this family until this child is transitioned. I just wanted to thank Roald Dahl's Marvellous Children's Charity for the opportunity to do this course, because it really has made a big difference.
My goodness, thank you so much, Tina. Wow, I can see today is going to be an emotional roller coaster as well as a celebration. Thank you. You really took us to the heart of that improvement project to understand the difference that it made to that family. So I appreciate that. Thank you. I'm going to ask now, invite Dame Liz to ask some questions or give off some reflections on what she heard there from Tina.
Tina, thank you so much. And that had enormous resonance for me, actually quite emotional, because one of the most significant things I think I did last year was to meet the Barefoot Soldier. You may have heard about him. He was walking barefoot from Land's End to John O'Groats. He was a major in the army with a child with a very rare condition. And I met him as he entered into Nottinghamshire early one morning before he was setting off. Whilst I wanted to obviously support him in his journey, I was also fascinated as to why he needed to do that walk to collect money to support his child. And he said 2 really significant things to me. Well, first of all, I asked him about his daughter. And the most significant thing he said was the total frustration within the family of having so many people looking after her, all individually brilliant, but totally uncoordinated. And you will know, and some of you will have heard the family talking the other day on the radio about having 150 appointments a month for their child. This is a very common problem. The thing that really got to me, though, was when I said to him, now, Chris, just tell me, how are you and your wife? Who's looking after you? And he looked me in the eye and he said, no one. And my question to you is, how can we spread what you're doing across the country so that other people pick up those really excellent elements that you've designed into your work?
I think for us, and I think the most important thing that we provide is that single point of contact, having that one constant person. So for me, I'd want somebody to take ownership of that, whether it is a nurse specialist or a paediatrician. I think it's really important to have that single point of contact. And obviously education of rare diseases and the impact that they have on these families, and that lived experience. And I think through the work that we all do with our marvellous children's charity, producing that sort of educational video, that will really bring it home. It's going to be so visual, and that lived experience is so powerful.
I mean, I am absolutely sure that those are all going to be brilliant. I think the important thing is that I know you've got a lot to do, but you need to share what you're doing, because it's not replicated in many places elsewhere.
Thank you, Liz. I completely agree. And Tina will tell you at the end of today that now you're part of the Florence Nightingale Foundation family, you're part of our alumni. We would love to support you to disseminate your work and think about how you can write this up for publication in various different ways to get that message out there, because this is really something to be celebrated.
Thank you.
Thank you, Tina. Well done. You've got us off to a fantastic start. And thank you for your reflections, Liz.
Thanks.
We'll move on now to our next presenter. So we're now going to hear from Teresa McIntyre, who is going to present on improving the utilisation of nurse-led clinics for us. Whenever you're ready, Teresa, I shall hand over to you. And again, Tina set the bar brilliantly in keeping in line with the time. So if we could follow along that vein, that would be wonderful.
Okay, no problem. I'll try my best.
Thank you.
Okay, so my name is Teresa McIntyre, and I'm an epilepsy nurse specialist based at the Princess Royal University Hospital, which is part of King's College Foundation Trust. And my quality improvement project was improving the utilisation of nurse-led clinics. So next slide. So basically, I'm just going to go through the project approach and the results that I found. My goals, hopefully for the future, the challenges I faced during doing the project, my own leadership learning, a couple of references, and then time for questions. So I've always found it really difficult to sort of fully define my role to others, but when researching for this project, I found quite a number of studies that identified the role better, and one in particular, or sort of many actually, that showed the value of nurse-led clinics. So in my hospital, nurse-led clinics were set up and allocated to me, but there wasn't really any thought about how these would be used. And so as a result, I felt the clinics were often underutilised. When COVID-19 came, all of our clinics were suspended, as I think most were around the country. And as time went on and we realised that this was going to be a long-term thing, I felt that it was the right time to really think about how I could best use my clinics to help the families that are under our care. So with this in mind, I carried out 2 audits, and both of them were over a 4-week period. And I used these audits as a baseline, really, from which to carry on the project. For the first audit, I recorded the number of vacant slots in my existing clinics. And these are slots that I've never actually booked people into. They're not DNAs or anything like that. So it's just that I hadn't actually booked people into these. And then for the second audit, I looked at the type of calls and emails I received, again, over a 4-week period, and identified common themes that kept cropping up. So next slide, please. So I don't know if I should have put these around the other way, but anyway, in figure 1, you can see that the attendance in my clinic pre-project ranged between 28% and 61%, whereas after I finished the project, the attendance increased to between 81 and 100%. So obviously that was quite a marked improvement. And then figure 2 shows the common themes that were identified from the queries I received. So the most 2 common were related to breakthrough seizures, I think 29%, and medication queries, which was 22%. Excuse me. But we do get a range, I'm sure everyone's the same, we do get a range of queries. And in the other, I even had things like, my child has ingrown toenails, is this anything to do with epilepsy? So it's kind of like just figuring out what we need to address and what our priorities are. So I must admit, when I first looked at the figures pre-project, I was actually quite embarrassed and a bit disappointed, because it looks like, you know, I wasn't booking anyone into some of these clinics. But I think I realised quite soon that it was actually more to do with the setup of the clinics rather than me not being able to fill them. And I just realised I needed more structure. So I used the results to create topic-specific clinics, and also I drew up a job plan which was similar to that used by the consultant that I work with. And this was to avoid really getting caught up with every query that comes my way, because I sometimes feel like my practice is a bit chaotic, and I don't think I'm alone in that, because I think we tend to try and deal with things as they come through and not really allocate a time to deal with them. So next slide, please. So I think in the future, I need to continue to audit the effectiveness of the clinics, and I've created a feedback form, which I hope to give to all the families within the next 4 to 6 months. I'll also continue looking at the queries that come my way, even though it's quite time consuming and it can be a bit laborious, but I think it's really important just to make sure that they continue to be relevant to the families in our care. I'll also tell the families about the role of the nurse-led clinic and my role in particular, because I think lots of them are used to just having appointments with the consultant, but due to demand, we just can't have all of our clinics run by consultants only. So therefore, hopefully I'll be able to engage more families. And in the future, I'd like to adapt a system whereby they can book directly into these clinics. And then my last point really is to gain additional admin support, but I'll talk about that on the next slide, please. So obviously, I put this one down actually, but I've changed my mind. I hope you don't mind that, because I don't think it's going to be such a challenge, because the more that I've done virtual clinics, I think actually families do prefer them in lots of cases, particularly when they've got children with multiple disabilities. So I think actually the virtual clinics, I think the attendance will still be quite high for these. So I think I'm going to leave that as a challenge. I think there is already so much admin that we do as CNS, but this project really identified a need for support in this area. So for my own clinics, I send out the invites, I book the families onto our electronic system, I act on the appointments, I write the letters, I post them myself. So this all takes a great deal of time. And if you've got 26 slots per week, not all of them need letters necessarily, but it takes up a vast amount of my week. So some of the senior staff were ill with COVID or either shielding, so it wasn't possible to engage all of them. And I would have liked to talk to more people before the project started, but I've actually done that in retrospect, so that's quite good. And also, I think just running the project during COVID was challenging, because obviously work pressures, redeployment and remote working made it all such a different experience, definitely for me anyway. So next slide, please. So my leadership learning, I think like Tina, I've realised the importance of planning any project. And even though work's been busy and different, I've been able to just take time out and think through what I want to change and why I want to change this. I think data collection and analysis is really key to any project in order to see the effect of the changes that we make in any part of our role. I have had to dig deep at times to sort of convince myself that this is a worthwhile project, but this has helped me to have a bit more confidence in my own abilities, and also it's something I want to continue building on. Flexibility is really important, so when things don't always go as planned, just being able to adapt and continue. And finally, just really being part of this program, and also even with the WhatsApp group, it's made me realize even more that we're all different, we all have equal strengths, and by sharing our ideas, we can hopefully make great improvements to the lives of those in our care. And the next slide is just a little quote from my namesake, which I just thought summed it up really. You know, what we can do, others can't do, but together we can do great things. And that's it. Next slide. I think there's just, oh yes, a couple of references, sorry. And then just a thank you really for allowing me to take part.
Well, thank you, Teresa. That was wonderful. And I really agree with you that the power often of these programs is less about the content and more about the network and that kind of cohort learning and the support that you offer each other. So that's wonderful to hear from you. I'm going to ask Liz Fenton now to ask, see if she's got any reflections, thoughts on your presentation there.
Thanks, Gemma. And hello, Teresa. That was an amazing presentation, and what a fabulous piece of work. And listening to you there, I was reflecting on what Liz Frad said earlier, and I think what you're doing by setting up your nurse-led clinics is giving those young people and families that that connection for them, that they have got that support, which we all know is so important. And I think, and your colleague earlier on talked about sometimes it's the little things that make the big difference, and often when we're doing projects like that we overlook those, but I think the work you're doing is absolutely fabulous, and you're really beginning to see impact. I get your challenges about the admin support. I think you're probably going to be a victim of your own success, aren't you? But perhaps you could challenge your consultant colleagues that you're actually reducing their workload, so maybe they can share some of their admin support to help you in that as well. But congratulations, it is just a fabulous piece of work, and I'm just so impressed.
Thank you so much, Liz. And I also saw Liz Frad making some notes, so I'm just going to check whether there were any thoughts, questions from you as well, Liz.
You should know me by now, Gemma. I make constant notes. Yeah, also thank you very much indeed for that. And actually I was reflecting on the many years ago when we first started to look at nurse-led clinics, and one of the things that we had real difficulty with was getting medical consultants to accept the notion that a nurse could lead in the way that you have described. And I'd be interested, because remember, I'm not there in clinical practice now, I'd be interested whether you think we've passed that challenge, or whether it is possible that in some fields and in some places that might still be something which nurses will find difficult to get acceptance of.
I think for me, I'm really fortunate. I mean, the team really is myself and one consultant. So I'm in a very small team with minimal admin support actually for both of us, but he is really supportive and has been, you know, looking for me to develop myself in so many ways in order to run these clinics, because I think he really values nurse specialists. I don't think it's the same story across other trusts, and I think other colleagues could probably say different things. But I think the majority of consultants in our hospital think that nurse-led clinics is most definitely the way forward, actually.
That's really encouraging to hear. Thank you, Teresa. And thank you so much for your presentation. I know if RADA were here, they would be proud. That was incredibly well articulated and very engaging. Thank you. So we'll move on now to our next presenter, Stacy Ratcliffe, and Stacy's going to talk to us about supporting children and young people on long-term anti-epileptic medication to change from liquid to tablet preparation. So really fascinating topic, Stacy, and looking forward to hearing from you.
Thank you. Hi, Gemma. Hi, hello, everybody. My name's Stacy. I'm a Roald Dahl rather, children's epilepsy nurse specialist at the Queen Elizabeth Hospital in Woolwich, which is part of Lewisham and Greenwich NHS Trust. Next slide, please. So I did my QI project on supporting children and young people under my care that have a long-term condition as in epilepsy to change from liquid preparation to tablet preparation. Next slide, please. I've been a bit fancy and added some transition, so I hope this is going to work. So yeah, so I had lots of ideas through doing the Florence Nightingale Foundation course about what I could possibly do, but this is something that I already do, and I'm sure many nurse specialists do, not just in epilepsy, but medication counselling is definitely a routine part of what nurse specialists do, and yeah, and is a really important part of the work we do. Next slide, please. So just to kind of give an idea to people, I thought I'd put in a bit of a case study. So, and I could think of a really good example. So I've got this child A who was 6 years old at the time. This is going back about 18 months, and he's got really complex epilepsy. It was really, really difficult to treat, and he had, you can press go, hopefully the next bit comes up, thanks. And he had attended A&E, and A&E called me and said, can you come and review? The patient's known to you. And I found just through conversation with mum that he'd had an increase in seizures, and that had been because there'd been really poor medication compliance at home. And she told me that every day, morning and night, it would take her well in excess of half an hour to an hour to give him his medications that were all liquid preparation. So at that time, I just asked Mum to pop along to the hospital shop, and she bought some Tic Tacs. And within less than 5 minutes, I played a game with her little boy, and I was able to teach him how to swallow tablets. There was lots of high-fiving going on. I made him a certificate and stickers, and he went home and his seizures dramatically improved. Next bit, thanks. So later on, he had an admission to a tertiary hospital for some further investigations to do with his epilepsy. And unfortunately, just because often it's something that happens in paediatrics, he was prescribed all of his medication in liquid, and he had really poor experience. And the stress of that caused him to have a prolonged hospital admission. And he also ended up having an NG tube and referral to psychology services. He had the NG tube in for over 6 months, and it took me a really long time to support the family to get him back onto tablet preparation. Thanks. So yeah, we got him back to good seizure control eventually, and but now he's on the epilepsy surgery pathway. So yeah, that's his story. So really quickly, just off the top of our head, these are all the reasons to switch. These are all the reasons why we should switch. But not only that, I thought it's not on that slide, but it's an opportunity. I reflect on that time with that child in A&E, and that was a really positive experience we had. And through that, Mum would always tell me, oh, he really liked me, he's really looking forward to coming to clinic to see me. And I was able to give that 6-year-old power over his condition. And I just think that is a really powerful thing to do. So even though maybe this is looked at as a trivial project, it is quite significant actually, and to what it can do to that child or young person is giving them a little bit of power and control over their condition, and teaching the child to do something as opposed to the parent, because often we're teaching a parent how to do something to the child or young person, and this is something that you're directly doing with the child and young person. So it is, yeah, something I'm quite passionate about. Next slide, please. I think many paediatric nurses will, I just picked this little graphic to demonstrate that we know actually loads of liquid medications are really horrible tasting. And I think I was sent this in 2015. I happen to still have it on my phone. So added that, we all know that they often taste yuck, and I'm sure many of us will remember times where we've possibly worked on the wards, and I can think of examples where many children have had to have NG tubes just for medication because they are so foul tasting. Next slide, please. So through the wonderful power of Twitter, I was able to see that not only was I passionate and this was an integrated part of what I was doing, is that other people were doing it, and that a team in Newcastle had done quite a big QI project within their renal service, and they had produced some really fantastic resources. So a video and a parent leaflet and a certificate for children, and they'd written an article about the QI project to show about all of the benefits there were to changing children, young people that are on tablet, liquid preparation to tablet. So the challenges, of course, I don't think there's a presentation that's not going to mention COVID. Of course, COVID was an impact, and I think unfortunately I wasn't probably able to run the QI project as I would have wanted to. However, you know, I had to adapt and show resilience, so I think the COVID was able to kind of bring out some different strengths. Thank you. Next slide. So here's my QI project submission, just to demonstrate what that looked like. And the next steps are quite exciting actually. So just yesterday, so it's ongoing within my service, and I will continue to do this as part of my normal practice. But I've extended this, and I've had meetings with other clinical nurse specialists, and I took this to our head of nursing general manager. And yesterday I had a meeting with finance, head of pharmacy, and people that look at cost improvement projects, and something that's now going to be run trust wide, and we're going to be looking at every time that there's an interaction with a child or young person that's on liquid, that we assess them to see whether it is possible to change them to tablet preparation, and that staff are trained to be able to do that. So hopefully this is going to be really far reaching, which is very, very exciting. Thank you. Next slide. So learning about my leadership, so this has given me an opportunity to kind of reflect on the things, my qualities as a leader, and I'm a bit of a dreamer, and I embrace change and innovation, and I'm really passionate about delivering high quality care, but I think also I'm able to see it's particularly with this project, I was able to see that it could be far reaching. And actually, if I looked at it from what the financial implications were and what the cost savings were, I'd probably be able to get really good uptake on this, which is exactly what's happened. So yeah, and just to say, the other parts that I've learned in this journey is definitely the professional networking, and I think there's really been quite a big buzz around the way in which certainly us Roald Dahl nurses are now connecting, and I think it's the start of really great things. So yes, it's been an exciting time. Next slide. And just to say a really big thank you to the Roald Dahl Marvellous Children's Charity and to the Florence Nightingale Foundation for giving me the opportunity to do this. So thank you.
Thank you, Stacey. That was really, really insightful. I love the sense of the ripple effect of these projects. You know, we start something and we demonstrate its value and its impact, and then before you know it, others want to get on board, and you're able to share that. And as you identified in your slide, could this be a national project? Is this the way that we move forwards? And we would love to be able to help you with that at the foundation and offer you that platform to have that influence, Stacey. So really well done. Fantastic work. I can see Sophie up on our screen there. So I'm going to ask Sophie if she has any comments or questions for you.
Thank you, Gemma. Well, my goodness, just blown away by all the presentations so far. Well done to everyone. Well done, Stacey. Many congratulations on your presentation and on your project. My reflections, as I was jotting a few notes down, actually, sort of the key word here that comes across is power. The power of Roald Dahl specialist nurses, the power of professional networks, and the key really is empowering children. And thank you so much for sharing the case story. That sort of really brings it to life as Tina did earlier, and it just shows really the importance of this work and of everything that you do. And just really, my other comment really is to say that sort of for next steps, absolutely, it's sort of far-reaching, all of these projects, and we very much want to work together with our Roald Dahl nurses and with the Florence Nightingale Foundation on sharing the results of your projects, to make a difference. So my goodness, thank you so much.
Thank you.
Fantastic. Thank you, Sophie. And Dame Liz, any further thoughts?
If I may, just very briefly, Stacey, I absolutely love that presentation. And the reason I do is that you started from the premise of what the child needed. It reminded me of Professor Sir David Hull, who some of you may or may not have known, but he was an amazing paediatrician who only died about 3 weeks ago. And he was an advisor to the World Health Organization, wrote all the standard textbooks on paediatrics, a wonderful man. And the first time I saw him after I was appointed to be head of children's services here in Nottingham was on the ward, sitting underneath a sink, examining a child playing with a dinky car while he had all his medical students and everybody around him. And it was something that he taught me, just with that picture in my mind, that always we start from the point of what the child needs. And that's what you did with those Tic Tacs. I think it's a very powerful story you have to tell. Well done.
Thank you.
Absolutely. Thank you so much, Stacey. That had real, I can tell, had real impact and resonance with your audience. A really great job. Thank you. So our next presenter, our fourth presenter, is Katrina. So welcome, Katrina. There you are. Your camera is on, raring to go. Katrina is going to present to us on improving information provided to parents for boys with DMD on corticoid steroids exhibiting weight gain. So thank you so much, Katrina. The floor or the screen is yours.
Thank you. So I'm going to present my quality improvement project. Next slide, please. So my background is that my name's Katrina Cousins. I'm the paediatric neuromuscular specialist nurse at Cambridge University Hospitals, and my quality improvement project was improving information provided to parents of boys with DMD on corticosteroids. Next slide. Thank you. So my introduction. So the main treatment used for DMD is steroids. This is due to the effect on muscle strength, and in some boys with DMD, they have an effect on stabilizing and improving muscle strength for a period of time. So a lot of our children go off their feet quite early on, but having the steroids will prevent them going off their feet. And some children on steroids are now still, when I say on their feet, still walking at the age of 15, 16, whereas before they'd be in a wheelchair much earlier on. So unfortunately, one of the most common side effects of the steroids is weight gain. And out of the 47 DMD boys at CUH, 33 are on steroids. So this project really wanted to provide a robust information to give to parents on the use of corticosteroids, in the hope that improving this information given to them, we can begin to see a decline in the numbers of boys exhibiting weight gain when taking the steroids. Next slide, please. So, as I said, the aim was to increase the child and family's awareness of the side effects of the weight gain in the steroids in boys with DMD. So the project looked at the DMD boys on steroids over the course of 3 months in all 3 neuromuscular clinics. So there's 2 consultant clinics and then my nurse-led clinic. So we obtained the weight in these clinics and we looked to see if there was an increased weight gain. This would determine if the side effect is common within our DMD boys. So the changes that we made, well, we first of all wanted to expand the project further over the coming months by obtaining the weight and to see if this was the overall factor. So we questioned the parents on their knowledge of the weight gain as a side effect and if they had done anything to counteract that side effect. And we would also want to provide a new information leaflet on weight gain and the use of the steroids when the boys are given the steroids for the first time, and to reiterate this every time they come back to clinic, have they got the leaflet? And over the period of 6 months, we want to obtain the weight and look to see if providing the information leaflet actually made a difference and we could see a decline. Next slide, please. So sadly, due to the global pandemic, as with everybody else, a lot of our appointments were video consultations. So we were unable to weigh all the children, mainly because a lot of our children didn't have scales in the house. However, some parents had reported that they could visually see a weight gain, and we could see that as well in the videos. Of the patients that were seen in clinic and weighed at they all had significant weight gain. I don't know if you can see the chart, but I've got a little pie chart at the top. And although not formally asked, some of the parents within the clinic would just say, oh, we didn't realise this was a side effect. Or, and even one parent said, I know you said it, but I didn't think it would actually happen to my child. So that was like a recurring theme, that they knew about it, but they just didn't really realise the impact. And the impact on weight gain on a child with DMD can actually be more significant, because then the steroids aren't really working because they can't physically move, because they've put that much more weight on as well. So it's kind of a really big challenge if you put on the weight, if you've got a neuromuscular condition, because it puts strains on all the muscles and everything like that. and the parents were noticing this. They were saying, oh, no, now put on weight, so now they can't do this and they can't get up off the floor even more. So lots of the parents were quite emotional with this weight gain as well. The parents I had discussed the new leaflet with, they were really pleased that this was going to be developed, because I'd said that I was going to put some healthy eating tips in there and little different exercises of what you can do. So yeah, the consensus was that this would be a really good idea. Next slide, please. So my next step is to actually produce this leaflet, which I've started working on, and I've got in touch with the dietitian to help with this, because I think healthy eating tips and portion size they know much more about. And also just talking to the parents, they've said what they do to help. So what might help one family might help another family. So I'm going to use the families as well to help produce this leaflet. Next slide, please. So my leadership learning. So it was because I have two consultants, sometimes they can be quite challenging. They work very differently, but because I wasn't asking any more of them, I found it really easy to do this project, because they were already weighing the children and they were already asking certain questions about weight. So I wasn't asking them to do anything more. And through this project, like I said, I've started to make contacts with the dietetic appointment department. Next slide, please. And I just wanted to say a big thank you to Roald Dahl Marvellous Children's Charity for sponsoring me to do the course, and thank you to Florence Nightingale Foundation for accepting me to do this and for presenting today. So yeah, that's it.
Wonderful, Katrina. And interesting now, as a mental health nurse, there are several of the medications that we utilise that also cause significant weight gain, and it's something that I think is again, what I'm hearing today is so transferable to so many other settings. So the learning in the local area is so important to spread and disseminate, but really well done. Thank you so much. Now, Greta's popped up on my screen, so that means to me that Greta's got a question for you, Katrina, so I'll hand over to Greta.
Not really a question, but a comment to say that was amazing. The other comment to say is that actually my clinical practice for over 20 years was in clinical genetics, and I was in post when the single gene was identified for DMD, and the number of families that came to our clinics with no hope of anything, of any specialist support. And now I hear you as a specialist nurse with a particular interest in boys with DMD. It really warms my heart to think that, gosh, all of those years ago, and now look how much has changed as a result of you as a specialist nurse, what we now know about the genetics of DMD, and then the pharmacogenetics. So incredible advances. Obviously not fast enough for those poor families many years ago, but really thank you for what you do. I found that fascinating to listen to. Thank you.
Thank you.
Thank you, Greta. And Dame Liz.
Thank you very much, Katrina. That was wonderful. And when you consider that steroids are an incredibly common medicine for so many conditions, widely used, I wondered whether, and again, you know, I hesitate to sort of suggest to people they need to be doing more, but there must be an applicability of the work that you've done for DMD to other conditions where they are using steroids as part of their medication. And I wondered whether it might be useful for you to talk to your colleagues as to whether or not your leaflet could be adapted so that it became more widely utilised.
Yeah.
Great point, Liz. Yeah, absolutely, Katrina. And any support that we can offer you in linking you with others, Katrina, would be really happy to. Thank you, and really well done. So our final presentation is from Karen. So welcome, Karen.
Hi.
There you are, I can see you there. And Karen's going to be talking to us about the implementation of midazolam training resource for nurses. So really interested to hear this, Karen, and whenever you're ready, please do go ahead.
Hi everyone, for those of you that don't know me, my name's Karen and I'm one of 2 epilepsy specialist nurses from Lancashire Teaching Hospital in Preston. So next slide please. So my project, my QI project, was to implement a Bucklam training resource for nurses. And the slide that you can see in front of you is the PowerPoint presentation poster that I submitted to the Florence Nightingale Foundation. Next slide, please. So the rationale for my quality improvement project was that Bucklam midazolam is used as an effective first-line treatment for prolonged seizures. And what that medication does, it acts on nerve cells in the brain to stop seizure activity and prevent a condition called status epilepticus. So I identified that it's really important that families are aware of how to correctly use Bucklam so that they can effectively manage their child's seizures at home. And what was happening, we found that in practice, when patients were admitted to the ward following a prolonged seizure, and thus required a take-home prescription for Bucklam, what was happening was that the families weren't being given the appropriate training to support the use of this medication. So the teaching wasn't there in place, and the ward staff were actually making a referral to us as epilepsy nurses, which obviously caused a delay in treatment and potentially compromised patient safety. Next slide, please. So the approach I used for my quality improvement, I used the Plan Study Do-Act model. And I found this was an ideal tool which helped to utilise, it was like a trial and learning method, and it allowed me to effectively test and evaluate my ideas. The next step we did was we collected some quantitative data, and we collected data over a short period of time, which was just a 6-week period. And we held regular meetings to discuss the progress, where we were up to with our plans. I ordered some Bucklam demonstration resources, and they were provided by the Bucklam rep. They're a free resource, so he was more than happy to help support us with that. And then I devised a Bucklam PowerPoint, which was going to be used to train the nurses to then deliver the training to the families. Next slide, please. So within my data collection, what we identified that on my caseload, we had a cohort of patients that amounted to 43 patients that already had a prescription for Bucklam. Within our 6-week period of data collection, we identified that 3 patients were admitted to hospital with a prolonged seizure, and Bucklam training was therefore required for these 3 families. And like I said earlier, that wasn't delivered at the time of that prescription. It was delivered later by myself and my colleague. And 1 patient was readmitted to hospital as the family were unsure how to give the Bucklam, and that could have been prevented. Next slide, please. So the desired impact of my quality improvement was basically to improve quality of patient care. I wanted to improve the safety of patients. And to do this, I wanted to provide nurses with the skills, resources and confidence to be able to deliver the Bucklam training to the families. And also to reduce the cost of a community visit, which is required if Bucklam training is not given prior to discharge from hospital. So we're only a small team. There's 2 of us, but we're only 1 full-time post, and we have a cohort of patients that spreads over 453 approximately patients. So what we wanted to do is ensure that our service was run more slicker, and we were able to accommodate the needs of the patient when it was identified that they needed this medication. Next slide, please. So the next step for myself is to roll out the training for the nursing staff. And then that's a challenge of how we were going to do that. So what we're going to do is look at training the nurses as they're employed on the ward as part of their induction package. We also are hoping, we already have a slot on the mandatory training for paediatric nurses. So I want to be able to roll out my buccal training within that mandatory training and use that as a resource. I need to be able to collect feedback from patients, families and the nursing staff who receive the training. And I'd like to have a link nurse between the epilepsy nurses and the ward and set up like a cascade trainer interest group so that we can help support the nurses as they're delivering the training to the families. I want to get on board as well our IT staff to help me with an e-learning training resource, and I think that could be incorporated onto our mandatory training. That just could be a quick update once they've had the more formal training. And obviously the next step would be to audit the effectiveness of my project. Next slide please. So my leadership learning, so I used open communication skills to share my vision and manage the project, and I utilised a transformation leadership style, and that sort of style helps to inspire positive change. It focuses on the needs for others. So I motivated and empowered others to work as a team, and allowed others to make decisions as well. So I allowed, so for example, the pie chart that you saw at the beginning, that was devised by my admin staff, and she took ownership of that and helped to support me in implementing that within my poster. So my challenge really was one, COVID, which is everybody's challenge at this time, and we were luckily enough, actually COVID helped us. We'd previously identified that we needed extra admin support. And we currently don't have any admin support at all. But actually with COVID, because we'd previously done some data collection, we was allocated some admin time. So staff were redeployed to us to help support us. So I used their skills in IT systems because that was a challenge for me. And I engaged them in helping me devise a Buccal database so that we could pull the information all together. Next slide, please. And these are some of the just some of the things that I took from our Florence Nightingale leadership, thinking about leading positively, sharing experiences, having a positive attitude, which was difficult with COVID times, and as a leader, thinking about being honest and open, being inspiring, and all the points that helps us to become a great leader. Next slide, please. There's some references there for the content that you'll find in the presentation. And then again, I just wanted to say thank you to Florence Nightingale, to Roald Dahl, and to Rada. I don't think Conrad's here, but hopefully he'll be proud of our 5 presentation skills. Thank you.
Karen, I'm absolutely positive Conrad would be. He'll be here in spirit, I'm sure. Thank you so much, Karen. I was thinking as you were presenting there, not only Conrad, but also Florence Nightingale herself would be proud. You know, you've really demonstrated how data is power and being able to use your data to influence is for me what I really heard through your presentation there. So really well done. Thank you, Karen. I'm going to ask Liz Fenton if she has any questions or comments for you, if Liz is there. Here's Liz.
I am, yes, and thank you. That was just another amazing presentation. I've been absolutely blown away by all of them. And I really appreciated your honesty, because I think when any of us try and tackle a piece of work like you've done, we can't be good at all the different elements within it. You know, so you recognised where there were gaps, but also where there were others that you could draw in that had that skills and knowledge to complement the work that you've done. And it is just an amazing piece of work, and I can only see that this is going to grow. And I love the way that you've incorporated that PDSA cycle into the work you've done. So many congratulations and thank you.
Thank you, Liz. And Dame Liz, do you have any comments for Karen and also for the other presenters that you've heard today?
Well, first of all, to Karen, I think I'm right. I think I've been listening carefully. I think you're the only person this morning that talked about safety. And you were also the only person, I think, that mentioned cost saving. And for me, those are two really significant elements of the work that you have done. So very well done. And just overall, I'm astonished by all of you. For me, it's been an absolute delight to sit in and listen to how things have progressed. I do try and keep in touch by reading the journals and talking to people in the profession still, but it's wonderful to have this opportunity to listen to what you've all done. And I think what you've accomplished is brilliant. And thank you very much on behalf of the children and families that you're looking after. Thank you.
Thank you, Liz. That's wonderful. And I'm going to now just, I guess, go from 5 amazing children's nurses to another amazing children's nurse and introduce you formally to Dame Liz Frad, who's been so generous to join us today with her time, because she is motivated and to want to hear from the experiences and insights from you guys who are doing such fabulous work. So if you don't already know, Dame Elizabeth Frad is a children's nurse, a midwife, and also a health visitor. And Dame Liz and I know each other as alumni of Nottingham University. Dame Liz has spoken to student groups that I've worked with on several occasions and inspired and motivated them, which is the reason why I wanted her to come and speak to you guys today. At Nottingham University, she's also visiting professor and vice president. Now, Dame Liz has had significant leadership roles at a national level. She was nurse director of CHI, which is now the CQC, and also the assistant chief nurse at the Department of Health. Her contribution has been recognised in all sorts of areas. She's a fellow of the RCN, the Queen's Nursing Institute, the Faculty of Public Health, the Royal College of Paediatrics and Children's Nursing, and was awarded her DBE in 2009. But for a number of years, Liz has been working as an independent advisor. But really interestingly, in this last year, Liz has been working as the High Sheriff of Nottinghamshire, which I am absolutely fascinated to hear more about. So real welcome to you, Liz, and thank you again for sparing your time today to join us.
Well, it's my pleasure and an absolute delight, Gemma, thank you. To share a little with you today of my year as High Sheriff. So you're now in for something completely different, folks. What I hope to capture, though, is to tell you a little bit about how the skills and knowledge that I've gained over, which was actually 50 years of working either with or for the NHS, and how those skills and knowledge have served me well during what has been a very tricky time for us all over the last year. In particular, I hope that you will pull out of what I say the issues that are so important that have been mentioned already. Tina mentioned it first thing about forward planning, and I would say, in my case, planning and replanning again. Careful communications, you've all alluded to that. Flexibility, we've all had to adapt, haven't we, this year? Teresa talked about having energy. The one thing I really try and hold on to is trying to stay as young as I can and energetic. Being opportunistic. An opportunity in life that you don't take is one that you will probably most regret. And Stacy talked about resilience, and really quite a lot of what I really want to portray to you this morning is about that resilience. The pandemic has had a significant impact on us all, and you've all talked about it. But I think it's been particularly hard on children and young people because of the isolation from their friends and their usual activities, and also because of their inability to attend the secure environment of school, where their progress and health is usually monitored and managed. If you're based in an acute setting, and I think most of you are, you may have observed delayed presentations because of parental concern about entering the hospital, or their inability to manage online appointment bookings, delayed investigations and planned interventions. These also may have resulted in some children presenting as more unwell than maybe then would have been the case. Like many other services, children's services have had to move online, and you've talked about that, leaving limited access to a safe place to talk freely in. Health visitors and school nurses in particular have been concerned about this, about the fact that they have not been able to perhaps pick up those who are likely to have eating disorders, depression or self-harm. And recent research has demonstrated that children and young people living in cities are more, have fared less well during the pandemic than those living in country settings. When one-to-one contact has been possible, it's been significantly different. And I think, you know, we've heard that so many times this morning, but none of you have talked about the difficulty of communication due to PPE. We all learn very early in our training that it isn't just what we say, but it's how we say it, how we convey that message. For example, through our posture, touch, facial expression, they all help to convey a message. And a smile, which is completely blocked by a mask, is a way of making people feel comfortable and welcome. And I'm aware, because I still mentor some senior people in the field, how children's nurses have had to be moved to unfamiliar areas of care to support services under significant pressure. Whilst this has been one way to ensure that those who needed care have been given that care, it has placed additional anxiety on those who have been moved, often to unfamiliar settings, and those that have been left behind have had to manage with less staff. Each of you will have had a very different professional and personal experience over the last year, but the fact that you are here today demonstrates to me a significant level of determination and resilience. So well done. My last school report noted that I had an obstinate streak. And I like to think that that was one of the early signs of resilience, something that I've needed throughout my career, in particular when working in the Department of Health and later when setting up what is now the CQC. I've needed a fair bit of resilience over the last year too. However, I mean, I might add resilience because the post that I'm going to describe to you carries no funding and has no administrative support. I was entirely on my own with an under-sheriff who's part-time lawyer, who's only responsible for the protocols that have to be carried out when in big events. However, in general, we are all limited only by our own desire and determination and our drive. So, you know, it is in our gift to make good, even when we have limited facilities and resources. In April 2020, I was installed as the High Sheriff of Nottinghamshire, which always gives everybody huge entertainment, of course, because of Robin Hood. This was done virtually while I was shielding. It's a role I suspect that most of you will know very little about, which is why I thought I'd just spend a little bit of time telling you about it, because historically it's fascinating. It's the oldest secular office in the United Kingdom after the Crown and dates back to Saxon times. The focus of the role was originally to enforce the King's interests in the county, in particular the collection of taxes and revenues and the enforcement of law and order. It took until 1976, when a woman was appointed as High Sheriff in Gloucestershire, to secure a real increase in the numbers of women. I was only the 8th woman since Saxon times to be appointed in Nottinghamshire. Remember, always reinvent yourself. Whatever you choose to do, try and do it to your very best. And that's what I tried to do during my year. In the early days, high sheriffs had really extensive powers. They judged cases in the monthly court and acted as sorry about that. They judged cases in the monthly court and acted as law enforcement officers. They could raise a hue and cry, and there'd be many people that have worked with me in nursing who would say I've raised many hue and cries, not always successfully. But in the case of a high sheriff, the hue and cry was to get after criminals in the county. And you could also summon a posse comitatus, which is a full military force in the county. The first female sheriff appointed in Lincolnshire in 1216 helped repel French invaders. Well, I'm jolly glad I wasn't asked to do anything like that. After succeeding centuries, the high sheriff's powers were steadily eroded as core functions were centralised. The Exchequer, for example, was established to administer the tax collection and to audit the sheriff's accounts, interestingly, and a system of itinerant justices from which the assizes were eventually evolved. Sheriffs, however, maintained responsibility for issuing writs, preparing the court, prisoners and juries, and executing sentences once pronounced. It was also the sheriff's responsibility to ensure the safety and comfort of the judges. And this is the origin of the high sheriff's role now, a continuing duty to have responsibility for the welfare and the well-being of High Court judges. In the 64 clauses of the Magna Carta of 1215, 27 relate to the role of the sheriff. From 1254, the sheriff supervised the election to Parliament of 2 knights of the shire. And in some counties, and Nottinghamshire is one, we still act as the returning officer for parliamentary elections. And I rather regret that there wasn't an election last year, and I won't go into all the reasons why I rather regret it, but I do. Because I would have loved the role to have been returning officer. During the Tudor period, further changes came with the creation of coroners and justices of the peace, and the Lord Lieutenants, of which I am a deputy Lord Lieutenant in the county of Nottinghamshire, were appointed as personal representatives of the sovereign, and they then assumed that military role which I mentioned earlier. In the 19th century, the sheriff's responsibility for the police was transferred to the local constabulary, and the prisons to the prison commissioners, and then finally the crown property to the crown commissioners. So what is the role today? It's an independent, non-political role appointed for a single year by the Queen. Supporting the Crown and the judiciary remains the central element of the role, lending active support to the principal organs of the Constitution, so Her Majesty the Queen, the Royal Family, the judiciary, police, prison services and other law enforcement agencies, together with the emergency services, local authorities, and also all recognised faith groups. In practice, this means supporting the Lord Lieutenant during royal visits, and I missed 3 because of COVID last year, ensuring the welfare of the visiting High Court judges when on circuit, attending on them in court, and offering them the hospitality in my own home. I decided to focus my year on health and welfare across the justice system in the county, in order to bring together one of the core roles of the High Sheriff, which is about law and order, and the International Year of the Nurse Midwife. And I made 2 decisions in advance of my installation. The first was to appoint the Dean of Southall Minster as my chaplain, because she too is a nurse and midwife, and I thought she would understand why I wanted to have that focus on health and welfare, and particularly when planning some of the big services of the year. The second was that I chose Equation as my charity. Equation is a small charity focused on domestic abuse. Little did I know when I chose it 2 years prior to becoming High Sheriff, that when I made that choice, domestic abuse was going to become such a dominant issue during lockdowns, including the impact on children and young people. And one of the reasons I chose this charity is because they work with primary school children, teaching them about what a good relationship looks like. I've done as much as I can to fulfill the requirements of the High Sheriff, but also to get this message of health and welfare across in all of those areas that probably often marginalise the work of healthcare workers. I was privileged to sit on the dais with the judge in the High Court on the day that he was summing up the evidence of the largest murder trial in the UK that took place during COVID. The case involved 8 young defendants, and because of social distancing, it required 4 courts in the Crown Court to be used, with all the IT connections, including out to Doncaster Prison, where one of the prisoners was in isolation. While in the building, I asked to meet those whose work goes unseen. And again, this was another feature of my year. I didn't just want to meet the important people. I did my best to try and meet people who sit underneath those that are always in the public eye. My respect for all those working in the court was heightened by this experience, and in particular those people that had the tricky task of listing cases, managing documents, and managing the really complex logistics of a case such as the one I described. It prompted me to give them all, each team in the Crown Court, a certificate of recognition for the work that they had collectively done to keep the court open throughout COVID and not have a single case of any of their staff or anybody that accessed the court. I gave as much support and encouragement to the police as I could and other blue light services throughout the year, including writing to the chiefs of each service, especially when I heard something on the news, or in the case of the police after watching Nottingham Police on the TV programme Police Interceptors. If none of you watched it, it's hugely dramatic. I visited the police station where the liaison and diversion team are based, which is led by a mental health nurse. And these are the people that are helping to decide which people are brought into custody are fit to be interviewed. And I met the lead for the police street mental health triage team, again, on site at the point of a crime having been committed, making a decision as to whether or not the person had a significant mental health or learning disability problem. I participated in the opening of the new memorial garden at the police and fire headquarters, and met the relatives of 2 policemen who had died on duty. Whilst I wasn't able to meet the probation staff, I did meet a number of young people who spoke about the experience of being on probation, which, contrary to what the press often portray, was largely hugely complimentary about the services that were provided to support them. One young man, for example, who was still on probation, only recently out of prison, described his probation officer as brilliant. I visited 4 prisons and also Rampton Secure Hospital. During each visit, I met prison officers, prisoners, and spent time with the healthcare staff. I was so impressed by the nurses and other healthcare staff at each organisation and how they were managing vulnerable prisoners during prolonged periods of restricted movement. During one visit alone in one prison, the emergency bell rang 8 times, requiring a nurse to respond to prisoners that had self-harmed. Most prisoners have been locked in their cells for 23 hours a day since the beginning of the pandemic, and most still are. At one of the men's prisons, I observed some prisoners making PPE for the NHS, and I was presented with a set of embroidered scrubs with my name on it. I think they hadn't realised how old I was and that I wasn't still in the front line, but it's a very beautiful set of scrubs which I'm going to give to my GP. I was struck by how many of the prisoners were really young, often saying how proud their mothers were that they were supporting the NHS. I spent quite a lot of time talking to these prisoners because, of course, they were the only ones I was able to access. They spoke about their mums and their grands, and you know, for me that demonstrated how vulnerable these people are and the histories that sit behind them and why they're there. When I asked one of the prison officers how the other prisoners who were left in their cells felt about the prisoners being unable to get out, they told me that they were really proud of the work that they were doing and that there hadn't been one single retaliatory incident because some people were getting a bit more freedom. I intend to continue to be involved in an artwork competition at the prison for the sex offenders. It's intended that the chosen artwork, which I'm going to be involved with, will eventually be placed on the walls of their library when it's finished being refurbished. It's a long time since I visited Rampton, so I was impressed by the many improvements, particularly in the accommodation, and I took my chaplain with me on that occasion too. And it was really fabulous. We were challenged in the first day room we entered by one of the patients, when you don't call them prisoners in Rampton, who challenged us which of us was the High Sheriff. I wasn't in uniform. And a question that was quickly followed by, had I got any money? What impressed me about the question was that when I asked why he wanted the money, he said it was for some outdoor gym equipment that patients on other wards could benefit from too. And given that this was somebody with a significant mental health problem, I just thought it was wonderful that they were actually able and had been encouraged to think about others beyond their own environment. I have to admit that I did ask not to be taken to the Women's Personality Disorder Unit because Beverly Allitt is still there. I had to manage the aftermath of her deeds on the children's ward in Grantham after she murdered several children and attempted to murder others. So it was something I didn't feel, even after all those years, that I was able to face. An ex-prisoner released from Nottingham Prison just before the first lockdown participated in a service in our Minster to recognise Prisoners Week, which takes place in October each year. This was the first time a service had taken place in recognition of this week here in Nottinghamshire. He talked to the congregation about his experience of being in prison and what he had learnt. He was really anxious for his mates still in prison who were experiencing being locked in cells for long periods. It was an immensely powerful event, even though there were only 25 of us in a Minster that holds over 1,000 due to the restrictions. But it included significantly my 2 young police cadets and also 2 of his children. I thought it was a very poignant reminder that the crimes of one member of the family have a huge impact on others. Speaking at the online swearing-in ceremonies of the magistrates was a highlight for me, particularly because amongst them were for the very first time magistrates being specifically appointed to the family court. And I'm actually speaking to their magistrates AGM tomorrow evening, and we'll be sharing some of what I'm sharing with you with them. All the big events for my year were either cancelled or virtual. And I'd have to say also constantly postponed. My installation in April last year took place with 10 of us in 6 different places, connected by Skype and WhatsApp. This was the early days, remember, of the pandemic, and things like Zoom had hardly been heard of. So with those really rudimentary skills that I had and one of my colleagues, we managed to ensure that the legal aspects, it has to be done in front of a a JP, were appropriately undertaken. Although it wasn't exactly what I had hoped for when planning the ceremony to take place in the medieval stateroom at the Bishop's Palace, which had been a courthouse in 1818. The Minster here in Nottinghamshire usually hosts the Queen's birthday service in June, the largest event of the Shrieval year. Sadly, this had to be a virtual event, with participants self-videoing their contribution, which the Minster staff managed to put together as a coherent service. Participants included the senior sister in the University Hospital ITU talking about her experience, and 2 army officers that led the building of the Manchester Nightingale Hospital. It was placed on the Minster website, enabling a large number of people to view the service, including those living in other countries. The 2 officers, the army officers, talked of what they had learnt from NHS colleagues and were hugely impressed by the commitment and dedication of staff. What they hope, was that the NHS learnt from them about the ability to respond at pace. The most significant event in the Shrieval year is the annual legal service, which normally takes place in March. This is coincides with the beginning of the legal year and is a celebration of the work undertaken by all those in the justice system. We decided to cancel the service in March this year, but in fact I've been asked by the Lord Lieutenant to hold a celebratory event in the summer so that I'm able to make sure that everybody at every level that's working in the justice system is able to celebrate appropriately. And that, I think, it's a one-off, and I hope it'll be a big event. The High Sheriffs Association supports one charity, National Crime Beat. Each year, projects are designed to reduce crime amongst young people, and they're submitted by the High Sheriffs for funded awards. And I was thrilled that one of the 3 projects that I submitted won. It's a social media campaign involving 130 young people who made 9 videos focused on stopping violent crime. And it was the first time that Nottinghamshire had ever won. Those young people made those videos using the voices of young people who had actually experienced violent crime, but that students in a college acted out the story. They are immensely powerful. It's in the gift of each High Sheriff to reward individuals or community groups within their county through presenting awards, and they're a way of giving recognition to people whose work might not otherwise have attracted appreciation. And I was really proud to give to 20 recipients an award, and collectively they represented for me the best examples of self-sacrifice, passion and determination to improve the lives of some of the most vulnerable young people in Nottinghamshire, particularly over the last year. And many of the recipients' work was focused on programmes to help them to fulfil their full potential and have mental health elements built in. And I presented these instead of at a big ceremony, one-to-one in car parks or wherever I could find a space, in the snow, in the rain, in the wind with my hat blowing off. But each was a very special occasion for all that were involved. And I'll mention just one because they were 2 children's nurses that have started a social enterprise which has gone worldwide, called Positively Empowered Kids. They are doing extraordinary work, bringing vulnerable young kids together with their families and supporting them and helping them to reach their potential. The awards and my visits reflect the increasingly active role of the Office of the High Sheriff in promoting a wide range of voluntary work with communities. The first visit that I was able to undertake after the first lockdown and when I came out of shielding was to the Guru Nanak mission to help with cooking meals for the homeless in the city and also to those that were being shielded. What impressed me was the involvement of men, women, and children in the cooking, and those of other faiths who helped with the packing and the loading of the vehicles ready for delivery. And one of the most significant things that one of the men said to me when I said, I wish I was able to keep my scarf over my head so elegantly like the other women that I was working with, he said, Liz, here we are all equal. So what are my reflections on the past year? Clearly, it didn't go according to my original plan, but as I've suggested, I replanned. But I think some good things did come out of the experience for me and hopefully for others. I have never understood the meaning of two words, no and patience. I have to tell you, my patience has not improved at all during the year, not least because of my frustrations at times with IT, and I have got supreme sympathy with Karen over that. But importantly, I have discovered that not saying no can be a good thing. I said yes to everything that came my way within reason, except when I was either shielded, in quarantine, which I was twice after coming in contact with people, once in the prison and once elsewhere, or when restrictions didn't permit. I think the result was that I made contact through the use of IT, which I've grown more confident with a greater number of people than would otherwise have been the case. It's a reminder to me that you and we should follow every opportunity that's presented to us. It also reminded me that actually staying calm is a power within itself, and to accept that what comes to us, we can cope with. I've learnt a lot, especially about one of the principal organs of the Constitution, that's the judiciary, in spite of the fact that I had significantly reduced contact with them. What I have gained is a sense of a very fair and just ethos across Nottinghamshire's justice systems that the public can be proud of and have confidence in. And my visits reminded me that so many people find themselves in significant difficulty due to health issues, peer pressure, lack of family support, and homelessness. I was reminded of the importance of good communications across different organisations so that individuals don't fall through the cracks, and you will all be familiar with that. It's possible, I hope I've been able to show that to you, for us to reinvent ourselves, even while maintaining a focus on what the job is really all about. And I was able to do that, I think, by my focus on healthcare during my year. All the organisations I'm currently in touch with enabled me to use my healthcare knowledge, and in some to speak on behalf of children. And this is my wider roles. I'm the Vice President of Together for Short Lives, which I hope some of you know about. I'm patron of Dayton Foundation, which is a charity supporting mother and child health services in Malawi, and also as an ambassador for Nottingham Hospice, a hospice which is for adults, but I encouraged 4 of the students at Nottingham University, when they were doing their project in end-of-life care, to take a look at the adult hospice and see how they could encourage the young people residing up to the age of 30 in the children's hospice to actually gain appropriate care, which is now the case, and they have a children's nurse leading that work. I also have an honorary professorship, as Gemma has suggested, and it provides me with an opportunity, I hope, to influence the next generation of nurses. Being a Deputy Lieutenant of Nottinghamshire will continue to keep me in touch with a wide range of organisations and people, so I'm never bored. Finally, I would like you, as you go about your work helping children and their families in the coming months, to work out what really makes you tick and what you're good at. And I want you to also take inspiration from an old Japanese tradition in which broken pottery pieces are put together with gold lacquer. The cracks are not hidden. The repairs are celebrated. Gold rivulets bind the shards of that object. The scars become art, and the result is something more beautiful than perfect, something visibly resilient. I wish you all very well. Thank you.
Wow, my goodness, Liz, that was absolutely phenomenal. I think you could hear a pin drop in this audience. Thank you so much for all of your thoughts, reflections. The identity as a children's nurse just shone through there in this recent role that you've had. Really significant. Thank you so much for sharing that with us. We're going to take some time now to break out into small groups for you guys to connect again with each other and have some reflections. Liz has led us beautifully into that process, because she's set you some challenges, some thoughts for you to pay attention to now, to frame your reflections. And we would also like you to think as a small group around how you feel you have benefited from the leadership programme, and one word or a sentence that really captures that for you. And when we bring you back into one group, we'll ask to hear that one word or sentence from each of you and edit that into a small film, so you can take that away as a memento of your Florence Nightingale Foundation experience. But our special guests will be leaving us at this minute, so it'll just be my absolute, again, pleasure to thank everybody. Sophie, Liz Fenton, Greta and Dame Elizabeth Frad, thank you so much for your time this morning and all of those key insights that you have offered us. Thank you. So I'll hand you over to the team now to break you into some small groups, and we shall see you again in 20 minutes time. So you have 20 minutes with each other. I'm really interested to hear your reflections from your discussion. Because we're all here, we'll need to keep it quite short and snappy. And as I said, what we'll do is edit this out so that you've all got a memento of your leadership programme, and just something to remember each other with as well. And as we've said already so many times today, the connections that you've made as a cohort, how you continue that as you move forward. So I'm going to introduce you to Carolina. Carolina's been in the background managing all the slides and letting people in and out of rooms and all of those kinds of things. So Carolina is our Academy assistant, and she is going to take us through each and every one of you. She'll call out your names, and when you hear your name, if you pop your camera on and give us your sentence or your word that describes your experience. Over to you, Carolina.
Great. Hello, everybody, and well done, everybody. What a great achievement, and it's really nice to see you. So the first person on my list here for a certificate is Kirsten Johnson.
Well, I didn't think it would be me first. I think the thing that I've taken away is having a confidence in my power as a leader, but also it's provided me with a structure to make change and lead.
Excellent, thank you. Next one is Lisa Cutsie.
Hi. I think it was just really nice to be with a group of like-minded people, and quite inspiring to see so many other nurse specialists during the pandemic and doing different jobs, but with such enthusiasm. And it was very nice to spend some time with other people doing similar jobs across the country in different trusts.
Fantastic, thank you, Lisa. Next, Tina Boswell, please.
I would say personal growth and confidence.
Brilliant, thank you, Tina. And we have Rebecca Case next, please.
I think that I found the course inspiring and empowering, and it's given me a lot of clarity and cohesion about thinking about things, because it's very difficult to not get bogged down in the immediate part of your job, but actually by learning and by leading, we improve outcomes for more people.
Yes, we certainly do, Rebecca, thank you. Next is Edith, and I'm sorry if I pronounced it incorrectly, the surname, Imuyu.
The leadership program helped me to be more outspoken, and more confident, and now being able to take up, probably make a change within the team I work in.
Fantastic, thank you, Ida. Next person is Stephanie Lawrence, please.
Yeah, I'd say the course has inspired me and motivated me to change and improve myself, but also the service for the patients and everyone involved.
Thank you, Stephanie. Next, Katie Ward.
I think for me, it's allowed me to kind of have that more self-awareness of what skills I do have, an acknowledgement of those, and what I am already doing in practice. That, you know, leaders come in different forms, shapes and sizes and in different places, and to be able to make differences, you know, within our role in different ways.
Brilliant, thank you, Katie. Next is Neil Fletcher, please.
Hi everybody, I was a little bit late to the party, so nice to see everybody. I think I probably struggled with one word, so I'm going to say RADA as a bit of an acronym. Absolutely thoroughly enjoyed that session and took away stuff that I'm using. Trying to do it now. Think, breathe, speak, and a lot of those other things around presentations. So RADA would be my acronym.
That's great, thanks, Neil. Next is Giselle Padmore-Payne, please.
Hi, thank you so much. So I think for me, it was really good to get together with the group of the Roald Dahl nurses. So that felt as though we could connect again. But I think learning a lot, and Neil is right, RADA was really good for me as well. I haven't used that concept before or heard of it before the leadership course. So that was really good for me. It was quite difficult sometimes during the course for me as well. Like, you know, everyone had difficult workloads and stuff. So I'm very proud that I was able to complete the course as well. But I think it sort of helped with confidence, and like we just discussed in our group, like the things that we do can be used as quality improvement data and tools. We just didn't realize it as well. So simple things can make a difference, and the course has taught me that, as well as being able to speak up more and have a bit of theoretical knowledge and evidence to back it up. So yeah, thank you.
Fantastic, thanks, Giselle. Next is Anne Brown, please.
Yes, so for me, it's about motivation to produce more quality.
Brilliant, thank you, Anne. So we'll move on to Karen O'Neill.
Hi, so the word that sums up my experience of the leadership programme has to be inspiring, and that together we can make a difference.
Brilliant, wonderful, thanks, Karen. Now we have Katrina Cousins, please.
So first and foremost, I'm really proud of myself that I managed to complete it, like I think everyone else is as well, especially in the struggles that we've all faced. It has definitely empowered me, but it's also made me recognise that I was a leader before and I implemented quite a few changes before, and hopefully I'll continue to do that.
Wonderful, thanks, Katrina. Now we have Nikki Tuffin. Nikki Tuffin, please. No? Okay, we'll move on then to Caroline O'Neill, please.
One word I would like to use to sum up the course is awesome. And it's because the course has given us tools from so many different disciplines that we can apply to our practice going forward. Some of them we found we're already using them, but it just makes us fine-tune them better. Thank you.
Okay, thanks, Caroline. We have Katrina Bottle, please. Next. Katrina.
Hello.
Bottle.
Yeah. Yes. Okay. Yeah, I'm here, definitely. I think for us, for me, it's been quite a thought-provoking course to be on, really sort of looking more at perceptions and things and how you approach things, and also about holding your intentions at the forefront and what you want to achieve. So in any meetings and any conversations, and just taking that time to think. So yeah, it's been really helpful.
Super, thank you, Katrina. And next, Stacy Ratcliffe, please.
Yeah, hi. My takeaway is power, really, and it's given me the opportunity to appreciate and recognise my own power in my vision and in the innovation and in the leadership qualities that I have.
Brilliant, thanks, Stacey. Teresa McIntyre, please, next.
Yeah, so I think the course has given me sort of great focus and direction, and I think taking the time to plan and think about what I want to do has like genuinely changed my practice from moderate chaos to a little bit more structure, and hopefully I'll improve as we go on.
Hope so too. Thank you, Teresa. Next is Elizabeth Joshua John, please.
I would like to say the word productivity, like to be able to be productive in what you do. And this course has been amazing. Thank you.
Thank you, Elizabeth. Next is Zara Asri Evans, please. Or is it Sarah? Zara, Sarah. Sorry. No? And then we have Lucy Bellis, please.
Hi, mine is to believe in your own abilities.
Fantastic. Thanks, Lucy. I hope I've covered everybody. I haven't missed anybody, have I? If I have, just raise your hand or speak. No? Okay. Thank you very much. Wonderful. Fantastic.
Brilliant. Thank you, Carolina. And for me, I guess one of the things as I'm listening to you, we started on that very first welcome day talking about your leadership signature and how the programme was going to enable you to really define and enhance that very unique approach to leadership that you already are taking, but also to enable you to enhance that influence moving forward. And that's when I listen to you all, that's what I've heard from you. You're absolutely right. You are leaders. Of course you are. You are absolutely pioneers in your fields. And many of you are paving the way for specialist roles that have never existed before. But what you might have achieved or might have developed through this time is a sense of self around that leadership identity. And that's really what we hope to have achieved. And some of the tools and skills that you take from RADA will just enable others to appreciate that level of insight and expertise and influence that you should be offered. So I am absolutely thrilled. My face is aching from smiling at everything that I've heard today. It's been an absolute joy to spend this time with you. Now, the great thing about the Florence Nightingale Foundation is the wider network that you join. When you become a Florence Nightingale Foundation nurse, you're also part of our wider family. And that means that you're part of our alumni community. So I'm going to introduce you to Adam now, Adam Rubinowitz, who is our alumni and membership manager. And Adam's just going to talk to you a bit about what it means to be part of the F&F alumni.
Thank you very much, Gemma. I hope everyone can hear me fine. So yes, congratulations everyone on making it through to our illustrious alumni community. There are many benefits with becoming an alumni, and I'll go through some of them now. But after I finish, I will be sending you all an email and just basically say that you've now been set up on our system for getting regular monthly newsletters, which will outline all the benefits that we can give you. And I'll just talk through a few of those now. So you'll obviously be part of the community. And what does that mean? Well, you will be part of this network that you'll be able to go on to workshops, events that are free events, and you just join a whole range of different subjects and dealt with, but you will be part of that and you can just join whenever. And also it'll highlight other areas that you can help with influencing. We have an advisory group and a governance committee, and there's lots of calls to action. And we will be also setting up a community online on a portal which we're just sorting out, and you'll be able to assist each other in all of that. So there's a lot of benefits really, and you will see from that there will be opportunities to really change things. So thank you once again, and we look forward to communicating and being part of this wider community. Thank you very much.
Thanks, Adam. So a couple of key messages there from Adam. There, when we call out to you, calls to action, we get invitations to sit on various different policy reference groups or to convene subject expert groups around particular areas. Please do consider those opportunities and don't think, oh, you know, Adam was reaching out to Bex or Katrina, but that doesn't account for me. It does, it absolutely does. We're inviting you all to be part of these opportunities moving forwards. But similarly, if there are things that you think that the foundation could do to support you, or there are individual goals that you're hoping to achieve, I was thinking about, for some of you, maybe writing up your projects for publication, those kinds of things. We've got either we can provide you with that support, or we can link you with others that can enable you to achieve those things as well. The great thing about Florence Nightingale Foundation is because people have benefited so much themselves from the experience, they always want to give back. So we have a very generous network of very engaged alumni. So please do make use of this organisation and what we can offer to you moving forward. So if we were all in a room together now, we'd be having a glass of champagne and we would be saying cheers, and we would be giving you a physical certificate and a lovely little pin badge. And nurses love pin badges, don't they? Can't get enough of them. Well, that will happen eventually. We will be able to post those out to you, but we're not going back to our office until July. So when we are back in the office in the summer, we'll post out your certificates and your pin badges to you. But we also want to ask you to complete your evaluation of the programme. So you will have been emailed a link, and also Carolina, right at the beginning of the session, put a link into the chat box. I think she might even pop it in there again now, so it's easy for you to access. And we purposefully schedule these sessions to finish a little bit earlier to give you time to do that evaluation. So as soon as that evaluation is complete, we will email you a certificate. So at least until we can give you that physical certificate, you've got an email certificate, so you can pop it in your revalidation folders and on those kinds of things. So any final thoughts before we close today's session? Any comments that you want to make to each other, to the foundation? And the floor's just open for a few moments to hear from you. We're going to read those alumni email newsletters, and I'll be seeing you again soon when those opportunities pop up. Yeah, brilliant. Well, it's been an absolute pleasure to spend this morning with you all. I knew that it would be an inspirational morning because I know the calibre of nurses that you are, and you haven't disappointed us at all. So thank you so much. Well done to all of the people that presented today. You did yourselves, and you will have done Conrad at RADA proud as well. Have a great rest of the day. Take care, everybody.